Hello, my name is Tracy now and I'm a Research Officer here at the Sydney School of Public Health. For the last year or so, I've been involved in the ASAPA project, a national project to support a systems approach to physical activity in Australia. And in this presentation, I'll be sharing with you the findings from one component of our work, which we've been conducting to map and understand physical activity programs in Australia. A key component of the ASAPA project is to map the 3 Ps: prevalence, policies and programs. In relation to prevalence, we've been looking at how population physical activity levels are measured by the different jurisdictions in Australia, how those measures differ and how they might be harmonised, and that work is currently in progress. In relation to policies, we conducted a comprehensive audit and analysis of policies relating to physical activity across state, territory and national jurisdictions in Australia and across different sectors, and that work was completed last year. And finally, the programs component is the subject of this presentation. Stepping back a bit, the bigger picture for the work of ASAP is to foster systems thinking approaches to physical activity in Australia, a shared vision of collaborative policy actions to improve population level physical activity, a self-managed cross-sectoral network of policymakers addressing physical activity from different angles, and a web-based knowledge hub supporting a community of practice for better implementation, strategic governance and coordination. The aim of the program's mapping work was to identify what population level physical activity programs and large-scale interventions have been implemented in Australia in the last 5 years, with a focus on those relevant to adults 18 and over. What do they focus on and how do they address physical activity? And what information is available about their scale and reach? In relation to scale, this had 2 dimensions in this audit: the scope of the program, whether that be nationwide, statewide or sub-state, and the scale of implementation, for example, the number of program sites, activities or participating organisations. In terms of reach, we were looking at the number of adults reached, ideally as a percentage of the target population, and where that data was available, the number specifically reached by the physical activity component of the program. This is a summary of the process we followed to identify programs and to collect the data. Overall, we included 73 programs, which was slightly less than the number originally identified in the national consultations, because some of those programs only related to children and we excluded those. So we requested data for the 73 programs and jurisdictions provided data for most of these. And where programs cut across different jurisdictions, we combined that data into one. We looked at 3 main things in auditing the programs. First of all, where were those programs available? So in what jurisdictions and to what scale? How do they address physical activity in terms of the population groups that they are aimed at, domains or settings that they relate to, and the types of mechanisms that they use to promote physical activity? And finally, what information is available about their implementation and reach? I'm not going to cover the availability of programs in this presentation. What I would say is that most of the programs in this audit were statewide in scale. What I am going to do now is to jump straight into the types of approaches used to address physical activity. Most programs were not restricted to adults, although to be included in the audit, programs had to have some component that was relevant to adults. Programs were primarily aimed at the whole of population, rather than specific subgroups, although some of these programs also contained components that were aimed at or adapted for specific groups. And you can see in this chart here the number of programs that were either primarily aimed at or which contained elements directed towards one or more of these different groups. We classified programs according to the domain or setting that they best fit into. Most of the domains were based on the 7 best investments for physical activity, with the addition of workplaces. We created 2 additional settings, which you can see in the second column, to cover programs that didn't quite fit into any of the domains. Local government and communities for programs delivered by local governments or community service providers or which were run in local communities, and remote delivery for programs delivered by phone or online. You can see here the major domains or settings where programs tended to target. Most were aimed at the sport and recreation and local government and communities domains, with far fewer in the workplace, primary and secondary healthcare, and urban design and infrastructure settings. And you can see examples of programs that fell in the main domains in each of the boxes. Most of the programs aimed at subgroups related to the sport and recreation or the local government and communities domains. And these included things like specific funding streams to increase physical activity opportunities for particular groups, translated information or campaign messages for culturally diverse groups, falls prevention for older adults, and modified sports and other program adaptations for particular groups. And we've included some specific examples in the boxes below. We classified programs according to the modalities that they used to promote physical activity. Modalities were adapted from an existing international classification for physical activity interventions and covered interventions with an individual, group, provider, and environment focus. This chart presents the main types of modalities used by programs to promote physical activity. So you can see on the left-hand side that the most common modality was funding to support the delivery of programs by others. Information provision was also a common strategy, and we included mass media campaigns in this category. Modalities that were aimed at improving an organisation or a community's ability to promote physical activity were classified under capacity building, and these included strategies such as partnership development or the provision of toolkits to enable, say, communities to organise their own initiatives. And at the other end of the spectrum, you can see that environmental change and transportation interventions were the least commonly used. Most of the funding programs were in the sports and recreation domains, although there were also a few in the local government and communities domains and a couple of examples in the transport and urban planning domains. Something to bear in mind, however, is that the funded programs may in turn use a whole range of other modalities to support physical activity, but these other modalities weren't classified in this audit. I'm now going to take you through the evaluation data provided by the jurisdictions on implementation and reach. Jurisdictions provided data for most programs, although not necessarily for both implementation and reach. And although we asked for data from the last 5 years, most of the data that was provided were for a period of up to 3 years. Jurisdictions were provided with a template to complete with their program's data, and we suggested that data on implementation could fall within 3 main categories: number of program activities, program sites, and number of participating organisations. Jurisdictions could provide implementation data relating to other things, but in most cases the information we received fell within these categories. What you can see here is some variability in the information provided for these categories. So looking at program sites, this was defined variably in terms of number of defined units, such as workplaces, or broader categorisation, such as number of LGAs. And this is just something to bear in mind when interpreting the numbers in the final column. At best, what this gives us is a partial picture of implementation of physical activity programs in Australia. The main limitation is that we don't know what these numbers are relative to in terms of a denominator. So using a hypothetical example, would implementation across 50 workplaces be considered a little or a lot? And this would really depend on whether the program is targeting particular workplaces, such as those of a certain size or from certain industries, or workplaces in general. And those overall numbers just weren't available to us. As we saw a couple of slides ago, population reach data was available for just over half of the programs. Of the programs that did provide reach data, population reach most commonly fell within the thousands. However, very few programs reported reach as a percentage or a proportion of their target population, and so we're not able to say for sure whether reach is small or large relative to those populations. What these numbers do suggest, however, is fairly limited reach compared to what we might expect from population-wide or large-scale programs. In summary, we found that programs primarily targeted the whole of population, with fewer programs specifically developed for subgroups. In terms of main domains, we found that most programs were directed at the sport and recreation domain, with far fewer programs in the workplace, planning and healthcare domains. The main modality used was funding, with environment and transportation interventions being the least commonly used. And finally, we have a fairly sketchy picture of reach and implementation. What we have learnt is that most programs are at least evaluated to some extent for reach and implementation, but the data that we have is only partly informative. The reach data that we do have suggests fairly limited reach, but we can't say for sure given that we don't have any insight into the size of the target populations and because many programs weren't able to provide reach data at all. As I mentioned earlier, the ASAPA project also undertook an audit of physical activity related policies in Australia last year. And while the methodology and findings between the two audits are not strictly comparable, there are some similarities in some of the things we looked at, in particular regarding the approaches used to address physical activity in terms of domains and mechanisms and evaluation. So here we've highlighted some of the similarities and differences in findings compared to the policy audit. And something we would point out are the apparent differences around planning, environment and transport. So in the policy audit, planning was identified as a leading domain, and infrastructure and service delivery were among the major mechanisms for policy action. However, few programs in this audit were directed at planning or used environmental change and transportation interventions. We'd acknowledge that despite fewer programs in these areas, each of these could have quite significant or even greater reach than programs in other areas. Nevertheless, one might query whether policy intentions are being translated into action, although there are a few other possible explanations. For example, there might be a time lag involved in the introduction of programs. And it's also possible that some infrastructure interventions were not identified by jurisdictions because they were not considered to be major or relevant to physical activity. We'll leave you with a few potential implications to think about in the context of your own portfolio and jurisdiction. These include the potential need for greater engagement with planning, environment and transport sectors, consideration around the sustainability and scalability of funding and funded programs, and finally, the need to strengthen evaluation practices so we have a better understanding about the scale of existing programs and whether they are in fact reaching their intended target groups. Finally, a big thank you to everyone who contributed to this audit, including the participants from our 2 national workshops and members of the ASAPA project working group. And of course, I'd like to acknowledge the other members of our project team who were involved in this audit. If you'd like more information about the ASAPA project, please visit the link below.